Well, a warm welcome to today's talk. It's Tuesday the 20th of April. Now, unfortunately, cases in the world and indeed deaths in the world globally are still increasing, and we believe this is largely due to the increases in India. Now, this is, of course, is incredibly disappointing. I'd hoped by this time that we'll be down to one video a week and that the world will be getting back to normal, but it's not yet. So we'll have a bit of a think about what's going on with the India situation. Some important news about the US here, an important appeal for the US as well, and how the what should we call it, the handling, that would be a good word, the handling of the restrictions on flights from India is going in the UK. Now, just to look at the United States first of all, unfortunately we see that cases are still going up slightly. Went down, lovely, nice reduction there, but still, you know, we're not at low levels by any means. We're still a 7-day moving average there, 67,000 new cases per day. And of course, this is feeding through into a certain number of deaths. Again, we would hope to have a much greater reduction by this time. So it really is pretty disappointing. My impression is, from an outsider, is that a lot of people in the States have, what would be the expression, taken their foot off the gas. And have sort of relaxed a bit more than is necessary. Just think what the situation would be like without vaccination. It just doesn't bear thinking about. So United States, another 46,000 cases in the last 24 hours, although that's below the 7-day average, 31 million officially diagnosed cases. Another 255 deaths, again, this is due to weekend load reporting. 4,881 cases in the past 7 days in total in the United States. And 566,000 deaths, very high numbers of deaths, and this is going to carry on going up for some time, I'm afraid. Having said that, the recurrence in cases in the States is not as high as we had feared. I had feared a greater recurrence of cases than this in the States. We did predict this actually back in sort of January, February. But it's great to see that the vaccination programme, I think, is the main reason that it's not gone up as much as we'd feared, but still gone up somewhat, so no cause for complacency at all. Now, vaccinations in the States, of course, going well. At least one dose, 133 million, 2 doses, 86 million. Doses distributed, 264.5. So this is slightly higher than the official figure. That's slightly high, but by the time you're watching, that's what it will be. And of course, if you add those up, that means there's 44 million doses sitting in depots around the country, or vaccination centres around the country, ready distributed, ready to be taken up. This is just a phenomenal piece of United States logistics. So anyone now over the age of 18 can book a vaccine. It really is brilliant. I mean, I did anticipate it would be good, but it's just... I knew the United States was capable of this. It's just gratifying to see it happen, is what I'm saying. So vaccines sitting, waiting now for people to come and get them. Now, this is quite a useful graphic. So 25.7% fully vaccinated. So they've had 2 doses of the vaccine, and after 14 days after the second dose, don't forget that. Got to wait 14 days after the second dose to get full coverage. That is good. Quite a few extra have had at least 1 dose. This is the amount that's eligible here. So this is the number of people still to go. So there's 44 million vaccines in stock now, and basically just waiting for people to come and pick them up now. I know there's more than 44 million there, but they will be shipping more out. This, of course, is the group of people under 18 who aren't currently eligible. So remember, these figures are for the entire American population. Now, the UK, I'm not saying the UK fiddles it, of course it doesn't, but it reports its cases as a proportion of those over 18, which of course is a smaller proportion than the whole population, whereas the United States are much more straightforward at reporting, really, in my view. These are percentages of the whole population. Now, Serum Institute of India, and this is still on the topic of the United States. Now, the Serum Institute, now the background to this is that the United States put in emergency powers I can't remember exactly what it was now. I think it's some sort of War Government Procurement Act or something. If you're in the States, you'll know much more about this than me. So they put in this special legislation, and basically it stops essential supplies being exported during times of emergency. Completely understandable. But the problem is that vaccine production and vaccine supply chains are now global. And the Serum Institute of India in Pune, which produces still most of the world's vaccines, have said that in a couple of weeks' time it's going to run out on certain components for the vaccine. And these components come from the States, but the export of these components from the States is currently banned under this emergency legislation in the States. Now, it's absolutely vital that the United States lift this, what is essentially a wartime embargo, and make sure the Serum Institute gets the supplies it needs, because India is desperate. And as well as that, the Serum Institute of India had initially agreed to supply 100 million doses to COVAX, and it's only supplied 30 million of those at the moment. Now, President Biden could reverse this with a stroke of his pen, and I really hope he does so. So we'll look out for that happening in the next few days. Now, I'm not saying the American authorities are being crass or cavalier. I don't believe they are. It's just time to review this emergency legislation and restore the global supplies. Now, I'll be keeping an eye on this. If it doesn't happen, trust me, I'll be on here. I'll be on here bouncing up and down, saying to all our American friends, please write to the president, write to your elected representative, and get this sorted out. I feel sure they will, and I feel sure that supplies will be flown directly to Pune within days from the United States. So let's just hope that happens. Otherwise, the consequences just don't bear thinking about, to be quite honest, if the Indians can't make their own vaccines. Now, I've put a link in for this. This is the Lancet official paper report on the India situation at the moment. And very, very thorough piece of work here from the Lancet. And some of it is lots of detail there on the Indian situation if you want it. And some of it is a little frightening. Frightening partly for what it does say, and frightening partly for what it doesn't say. And this is what it doesn't say, then this is what I'm concerned about. Now, India, this India mutation, double mutant, the so-called double mutant, the B1617, it seems to be outcompeting the UK and the Brazil variants. Now, this India variant is becoming the predominant variant in India now. We know it's about 60% in Delhi, and probably similar about 60% level in Maharashtra as well. And this is concerning because it seems to be spreading like wildfire through India, which is not a term I use lightly. It seems to be spreading prolifically and rapidly through India. It seems to be doubling every few days. Proper exponential growth. And it seems to be outcompeting. Now, the UK variant is in India. The Brazilian variant is in India. Even the South Africa variant is in India. And it looks at the moment like this India variant is outcompeting those. This is why I've been so concerned over the past few days. And there seems to be some level of immune escape. So in other words, some people that had the disease previously in India do seem to be getting reinfected. Now, not a lot of firm detail on that at the moment, but immune escape could include people getting reinfected who've had the original form of the virus, or even people who've been vaccinated. Now, I'm not expecting those people to get sick, although some will. It'll be a small percentage that get sick, I'm sure, but this is going to cause proliferation of the virus throughout the population, and this seems to be one of the factors. So that is what I'm really concerned about with the India mutant, that it is outcompeting the other mutants, which were already outcompeting the original form of the virus. More on that as soon as we get it. I want to firm that up with scientific references, but that's my concern at the moment. Now, early March, India's health minister, country was in the endgame, he was saying in early March. Well, it turned out to be false, unfortunately. This guy here, Public Health Foundation of India, there was a feeling of triumphalism. Unfortunately, too early. Some felt we'd achieved herd immunity. Well, to what degree was there herd immunity in India? And to what degree is it this new double mutant that is causing reinfection? Hopefully, the answer to that is not very much, but we really don't know that yet. This is my concern, and I think we should be cautious until we know more. Everyone wanted to get back to work, of course. This narrative fell on many receptive ears. They heard what they wanted to hear, and few voices of caution were heeded. So what we have now is over, the increase in India now is over 250,000 cases per day in terms of new cases. Hopefully you can just get rid of me a minute. Yeah. So these are new cases in India. So we saw that was, when was that? That was like October, November time. Now we have this massive exponential increase to over 250,000 cases a day. And at the rate this is going, it does look like we'll be on to, well, we don't want to make up numbers, but it's growing exponentially at the moment, and you don't need me to tell you what that could mean. In terms of growth, deaths are also now starting to increase as well. And the deaths in India now, so that's the increase in deaths on the official figures. The deaths in India now stand at 180,000 on official death figures. Now, I don't like sort of hearsay stories, and these aren't hearsay stories. This is directly from Al Jazeera journalists on the ground who've reported this. Non-stop cremations. Do check out the article for yourself. Very distressing reading. This city in Gujarat, the crematorium manager says, we're working around the clock at 100% capacity to cremate bodies on time. Very important in Hindu culture that cremations take place on time, of course. And also in the India situation, of course, the Muslims in India aren't cremated, obviously not. They are buried, need to be buried quickly and promptly under Islamic religious beliefs. And there's similar stories from graveyards around the country. Christians aren't too bothered, they'll be cremated or buried. In India they tend mostly to be buried, so again, pressure on burial grounds in India. But the vast majority of the Hindus are, no, I wouldn't say the vast majority, but the majority of Indians are follow Hindu tradition anyway, and are cremated. Don't meet many atheists in India, really. So most people fall into those three categories. This is in the city of Surat. Al Jazeera report cremating more than 100 bodies a day over the last week, and yet the official deaths in the past week were 25. So this is quite distressing, but it does mean that the journalists here are considering that the deaths are either being officially, not so much officially underreported, but certainly a great delay in reporting. That the death situation, unfortunately, is quite a lot higher than that graph would indicate. Certainly talking to friends in India, they are massively stretched, and people are like going around trying to find hospital places which often simply are not there. It really is quite distressing that the Indian healthcare system is not able to cope, and people are dying now as a result of that. I'm hoping to have some Indian doctors on shortly. They're far too busy to talk to me at the moment, but I'm hoping to get some on the channel in the next few days. We'll get that directly from them. This crematorium, also in Gujarat, last month we were cremating 20 bodies a day, now they're cremating 80. So more deaths, unfortunately, to come onto the Indian tally in time. Vaccinations in India, first dose 127 million, doing 3.5 billion a day. To reach the target, they need to do 10 million a day. To reach their targets, 70,000 vaccination centres, which is good, but remember, in India there is nearly 1.4 billion people. It's just massive task. So, looks good, but it's not enough. Needs to be nearer 10 million vaccines a day in India. Now, the story of the UK variant. Now, the handling of this sort of illustrates quite a bit about this pandemic, really. UK variant, UK and the Indian variant is what I'm saying. So it's the Indian variant in the UK. 9th of April, remember the 20th today, 9th of April, Bangladesh, Pakistan, both put on the red list. Hotel quarantine, all that. 13th of April, Bangladesh had South Africa, but not the Brazilian variant. This is from WHO data. So that already been red listed from the 9th of April, rightly so in my view, rightly so, for quite a few reasons, to control international travel. So Bangladesh had South Africa, not the Brazilian variant. Pakistan had neither, India had both. But they're only banning travel from India as from this Friday, the 23rd of April. So let me just say that again, because am I missing something here? So on the 9th of April, they banned travel from Bangladesh and Pakistan, or put it onto the red list. On the 13th of April, a few days after that, Bangladesh had the South Africa variant, not the Brazilian variant. Pakistan had neither, India had both, but they didn't ban travel from India. If that makes sense to you, let me know in the comments. This lack of proactivity just so typifies the frustrations from this pandemic. Now it's the 20th of April, the India variant, 103 cases in the UK, mostly linked to travel, of course. But at the moment, so and people have got till Friday, they've got till Friday, the 23rd of April. Talk about that in a minute. Well, at the moment they're just self-isolating at home. So, so up until Friday, of course, what will happen is there'll be anyone who wants to come from India to the UK will all trash in now on Tuesday, Wednesday, Thursday, before the restrictions start at 4 o'clock in the morning on Friday. Because that'll mean they don't have to go to the hotel restrictions, and that's going to save them a lot of money. But of course, some of those people will be going, for example, to multi-generational households, and the children might be going out to school. The way this has been mishandled just beggars credulity. And if I'm right, or not if I'm right, if my fears are correct that the Indian mutant is outcompeting the other variants, then that means that we could have another wave in England as a result of the Indian mutant, just because we didn't close flights down for a few days. It really is ridiculous. And why we didn't close it down, bang, straight away yesterday. I mean, what happened? I talked about this on the video yesterday. Matt Hancock said India was going onto the red zone yesterday afternoon, but not till Friday. It could be too late. It really could be too late. The frustrations are just unbelievable here. Officially, of course, this is a variant under investigation, not a variant of concern. Well, I'm concerned. Public Health England, 25th of March to the 7th of April, reported that there was 3,500 arrivals from India. 161 of those, 4.8, tested positive for COVID-19. And we know this is becoming the major variant in India now, so that is not good news. And yet we're having these people with without hotel quarantine, possibly going to multi-generational households, children possibly going out to school. It's just, in India, in Australia, even their own nationals, the people that had right of return, couldn't come automatically unless they were given a slot. But in England, everyone, just come back. It's all fine, but it's not. Why don't we learn from Australia? Why don't we learn from New Zealand? Why must we suffer from this lack of proactivity, reacting when it's too late? Professor Mark Walpott, UK's former chief scientific advisor, these decisions are almost inevitably taken a bit too late. Well, this is what you call English understatement or British understatement. A bit too late, in truth. And what's absolutely clear is this variant is more transmissible in India and seems to be outcompeting the other ones. Becoming the dominant variant in India, so there's good reason for wanting to keep this out of the country if at all possible. But unfortunately, we are allowing it in as we speak. Flights are landing today that aren't going to go into supervised isolation. That will start on Friday. Most people who've travelled through India or from India in the last 10 days will be refused entry. As I say, unless they have a right of residence or a right of return to the UK, then they still will be allowed back. Whereas in Australia, Australian citizens or people with a right of residence in Australia were not allowed back. Automatically, they had to be given a slot. We have had a massive pandemic in the UK. In Australia, they haven't. This is the difference in approach. Others are going to go onto the red list. They will be on the red list. Hotel supervision, isolation, but not till Friday. Now, the UK variant, we've got an official tracker now for variants in the UK, so let's just take a quick look at that. That's it there, actually. Quite interesting. The link's there. Take a look for yourself. Just a few highlights from the top of it. Variants of concern are under investigation. So B117, of course, that unfortunately we know a lot about in the UK. Total confirmed cases, well, we know it's the majority in the UK. It's much more than 209,000. Then we have the South Africa variant. Then we have the Brazilian variant. Then we have this Japanese ex-Manaus variant called the P1. So basically the P1 and the P2 are both Brazilian variants. Can't see that for the sun now, can you? There we go. P1 and the P2 are both Brazilian variants, basically. And of course, the India variant is not a variant of current concern, so it's not there. It's not there. So let's hope it will be soon, but will it be too late? Office for National Statistics. Prevalence of people testing positive for coronavirus has decreased in all 4 UK countries, which is brilliant. Data up to the 10th of April. So just briefly. England, the week up to the 10th of April, the prevalence was 112,000 people. That's 0.21% of the population. Now, 112,000 in the week up to the 10th. The week before that, it had been 161. So a nice drop there. 1 in 480 people now. That's now. If I'd started this video before the sun came out, I would have put the screens down. But Wales prevalence up to the 10th of April, 0.11% of the population. It was 3,300 people, again down from 3,800 the week before. 192 in Wales at the moment. Northern Ireland, again, massive drop. Look at that. So the week up to the 10th, 2,600 prevalence. The week before that, 6,100 prevalence. So a nice drop there in Northern Ireland. Currently 1 in 710 people. Scotland, again, quite a good drop. It went down from 13,000 the week before down to 10,500. And now it's 1 in 500 people. So let's have a quick look at the situation now in the UK just to finish today. It's actually quite nice to see the sun come out, but it messes up the settings on your camera, so hopefully you could see that though. Right, the UK now, it's looking good. It's looking good at the moment. The directions are good. So here we are. I mean, there's any amount of figures on the website, of course. So people testing positive, down 10% on the week. Deaths within 28 days of a positive diagnosis. Excellent, down 26.9%. Patients admitted down 12.8%. So pretty good. Regional data there if you want it for the UK. So a quick look at the cases. It's always good to get it on the graphics. There we go. Nice gratifying reduction in the UK. It's not gone. We still have to take precautions, but it's going down. Gratifying downward curve. Deaths, that's cases. Deaths likewise going down very dramatically. Huge vaccination effect, of course, there. Absolutely brilliant. And people in healthcare, well, still people being admitted, but it's much less than it was, and people currently in hospital. Healthcare and the patients admitted to hospital. So that's new admissions. And the graph for people in hospitals, they've changed the website and it's not there, but it is down quite significantly. No, it's thinking about it, but it's not doing it. Okay, so anyway, you can see the reduction in hospital admissions there, which is pretty good news. So, going on longer than we'd thought, still concerns. And this is good news. This is Scott getting his Moderna vaccine in Humboldt County, California. So, excellent to see that. And I believe that people giving out vaccines are getting a bit fed up of people taking selfies during vaccination procedures, so we'll maybe give them a break. We've seen plenty of it now, but always good to see it happening. So, just as an aside there, I must say this clinician who's giving the injection is putting that needle into exactly the right place in the body of the deltoid muscle. We've seen so many go too high, go too low, and that one looks absolutely spot on to me. So further good news. Can't say if they aspirated or not, but that's a separate story. More to come on that actually, hopefully in the next few days. Okay, that is us for today. I hope it's sunny where you are as well. Thank you for watching.